So, though you will be signing a document stating that you consent to treatment, it is critical that we practice informed consent, which really means I need to know that you know what you're signing up for. If you have any questions, please allow me to clarify them with you. I can only conduct therapy with you. I can only be your therapist. I cannot give medical advice or prescribe medication, and I cannot provide legal advice. I've been working in substance use and mental health recovery for the last 6 years as a case manager. I am a student. I am currently enrolled in a master's program for marriage and family therapy, and I am being supervised by a licensed therapist. There are risks to beginning therapy. A common one is that your symptoms may initially worsen. Talking about painful events in our lives can be emotionally taxing. If you participate in therapy, you may experience strong emotions such as anxiety, frustration, sadness, anger, when dealing with painful situations or unpleasant past events. Therapy may bring memories or realizations that may be distressing. People sometimes experience unanticipated personal dilemmas, worries, dreams. Thus, trying to resolve issues with important people in your life, such as a spouse or a partner or a child, or other family members, may result in changes that were not originally intended. Also, there is no guarantee that this will be helpful for you or that treatment will be successful. However, there are many benefits to therapy. You might be able to build insight into yourself, develop a stronger sense of self. You may develop better coping skills. You may achieve a degree of mindfulness and peace, just to name a few. It all depends on what you're willing to work on. I am required to discuss payment with you as well. Fees will be disclosed up front as they are. If you are using insurance to pay for your services, your information will be reviewed by an insurance panel. Everything we speak about in here is confidential. It won't be repeated or talked about outside of therapy, with some exceptions. I will be communicating with my supervisor in an effort to provide better treatment. If there are others in your life, say a family member or an attorney, who need to be informed of your progress in treatment, then we need you to sign a release of information document that would allow us to communicate with whomever you sign off on. In other words, the only people who are going to know you're in treatment or know about your progress in treatment are the ones that you sign off on. If your attorney wants to enter any information from us, we can decline to work with them unless it is court ordered. Also, I am a mandated reporter. If you become a threat or danger to yourself or others, I will have to contact the appropriate authorities. That said, I want to impress upon you the difference between passive thoughts and real suicidal ideation. We're human. We all have thoughts that we might be better off dead. These thoughts are not reportable. This is not the same as having a plan or the means to complete a suicide. I do not want you to hide those kinds of thoughts because you're afraid I'm going to call the police. Other limits to confidentiality include any reports of child abuse, elderly abuse, dependent adult abuse, things like that. Lastly, I wanted to say that we, meaning you and I, are here to help you. We are here to collaborate on what will help you the most. And our relationship needs to remain professional.